Hi there. Thank you for joining today's NILE webinar. This is Emily Rosini. I'm the community director at the community relations director, at Immunize Nevada, and I will be moderating today's webinar. Before we get started, I'd like to review a couple of housekeeping items. First, if we should become disconnected for any reason, please call right back and log back in, and we will continue. Sometimes there's, of course, unforeseen technical difficulties. Second, please locate the chat box in the bottom left corner of your screen. If you have any questions, go ahead and type them in the chat box, and we will address those questions throughout and at the end of the presentation. Lastly, if you've requested nursing or pharmacy CEUs for today's NILE webinar, please make sure you complete the survey, which will pop up right on your screen at the end of the webinar, and we will also be sending out an email reminder to complete that survey. All CEUs will be emailed out within the next week, so please give us time to get those out. Before we begin, I'd like to provide a little disclaimer. Immunize Nevada's NILE webinars are made possible by the generosity of speakers who donate their time and expertise to benefit the coalition. The expectation and the goal for the community partners is to gain knowledge on immunization-related topics through non-branded, unbiased presentations. I'd like to now turn it over to our speaker, Candace Robinson. She is a medical officer with the Center for Disease Control and Prevention. Dr. Robinson has worked on projects in many different areas, including sexually transmitted diseases, vaccine-preventable diseases, cost analysis, and outbreaks. Candace, I'm going to go ahead and turn it over to you.
Great, thank you so much, and thanks everyone for joining us today. We'll get started with the presentation. So our presentation today is 10 ways to create a culture of immunization within your pediatric practice. After today's webinar, our learning objectives are you should be able to understand why your practice needs a culture of immunization, describe how all office staff play a part in creating a culture of immunization, describe 10 ways to create a culture of immunization, and identify free CDC immunization resources for parents and for providers. So first question is, why do you need a culture of immunization? And there are many reasons that having a culture of immunization is important to your practice. First of all, it helps you protect children through full immunization coverage and on-time immunization. Protecting children is something that all of us who work in medicine and public health are committed to. Second, research from CDC and others has shown time and time again that healthcare professionals are parents' most trusted source of vaccine information. So you need to be sure that you're conveying the right information to parents. We also know that parents are more confident in their healthcare decisions when they receive the same information from different people. For example, if they receive the same information from the doctor and the medical assistant and what they read on the CDC website, for instance. And finally, parents can get confused and lose trust in your practice if they are hearing different messages from your staff. For example, if one member of the staff strongly recommends a vaccine, but another one says they've chosen not to get it for their own children, or there's a conflicting message between two different people within the same practice, then a parent may become confused, and it could create mistrust. So how is your practice doing? One thing to look at are the Healthy People 2020 objectives. So the Healthy People objectives are 10-year national objectives for improving the health of all Americans. On this slide, you can see the Healthy People 2020 objectives, and you can compare these to your own rates to see how well your practice is doing. So they have objectives of 90% coverage for individual infant vaccines, 80% coverage for the 7 vaccine series that's listed there below, and 80% coverage of Tdap and meningococcal conjugate vaccines and HPV in adolescents. If you don't know how to assess your practice's immunization rates, there are several options. And you could potentially use, if your practice has an EHR or EMR system, if your state has an immunization information system, vaccine for children providers. You can also use IQIP, which was formerly the AFIX Quality Improvement Program to evaluate. And then for AAP members, there's also the Quality Improvement course that may also be another way that you can determine your rates in your practice. A culture of immunization, you really want to make sure that everyone in the practice plays a part in this. This starts at the front desk and extends into the waiting room and into the exam room and finally to the checkout desk. So every person within your office that a parent comes in contact with really plays a part in making that vaccine culture. So let's explore 10 ways to create a culture of immunization within your practice. The first way is to make parents aware of your practice immunization philosophy or policy. If you don't have a policy, you can develop one, and then once you have one, you want to post it on your website, insert a copy in new parent packets, tell parents about it during their first visit, or post it in the waiting room for parents who are waiting to be seen. This insert here is just a immunization policy. It's from the website of Gwinnett Pediatrics and Adolescent Medicine here in Georgia. And so theirs starts off with vaccines have contributed to a significant reduction in many life-threatening childhood diseases. We strongly believe in the importance of vaccines, and then they go from there. And this policy that they have is just their policy, but you can make your own policy. And there are many ways to make that policy and make it well known to your parents and patients when they come to your clinic. The second thing is to keep up to date on CDC recommendations. So CDC updates the immunization schedules every February. It's important to note, though, that CDC's immunization guidance may change during the year if recommended by the Advisory Committee on Immunization Practices, or ACIP. So the ACIP, as many of you may already know, is a group of medical and public health experts who develop recommendations on the use of vaccines in the civilian population of the United States. The ACIP meets 3 times a year, once in February, once in June, and once in October, to review the latest vaccine research and make recommendations as needed. And so even in between the publications of the child schedule every February, the ACIP sometimes makes updated recommendations, and those recommendations are published and then incorporated into the schedule when it's published in February. Now, there are 2 versions of the child and adolescent immunization schedule, a clinician version, which you'll see pictured there on the left side of your screen, and the easy-to-read or parent-friendly version of it there on the right. The parent-friendly version is available in English and Spanish, and they are both available on the CDC website at the address in the blue box. So you want to determine who in the practice is responsible for obtaining new schedules and keeping up to date on the vaccine recommendation. And so you want to make sure that you have one person who's designated to stay abreast of the new recommendations, and then make sure everyone else in the office is aware of those new recommendations. And then there are also different places where staff can find the schedules for clinicians and for parents. For example, for clinicians, you could keep the schedule if you posted them in your medication room, or sometimes the recommendations are incorporated into the electronic medical record system, depending upon your practice. Sometimes it's not, so you'd have to know whether or not it's incorporated in yours. In addition to having the print versions of the schedule, there are also apps on the smartphone as well. And then the schedule for parents can be posted in exam rooms or included in new patient packets, given out during well-child visits, etc. Other ways to stay up to date are to participate in CDC's educational program for healthcare professionals on immunization recommendations and related topics. So CDC has free immunization education programs for healthcare professionals on the immunization recommendations. And these are live webinars and web-based educational programs. The Immunization Net Conferences and Pink Book webinar series, the first two on that list, are live one-hour presentations combining online visual presentations with simultaneous audio via a telephone conference call and a live question and answer session. And on-demand replays of these presentations are available shortly after each event. The You Call the Shots module are self-paced, web-based educational programs, one for each vaccine plus other vaccine-related topics. There's also one, for example, for vaccine storage and handling and for vaccine administration. Now, if you go to the CDC webpage listed in this blue box, you can sign up for email alerts to be notified when materials are updated or when there are upcoming webinars. Boxes such as the one to be notified pictured at that website are located on the left side of the web page, and you just type in your email address and submit, and it's easy as that. And you can do that both on this page for vaccine education. You can also do it on the page for ACIP recommendations so that you'll be alerted when new ACIP recommendations are published in between the schedules. Also, when you have vaccine questions, vaccine-related questions that your staff can't answer, you can send the question to CDC. And NIP Info is an email service that answers questions, nipinfo@cdc.gov. And typically the questions are answered within 24 hours, but sometimes they have to be sent to a subject matter expert for additional input. But that's another great resource if you have a question that you can't find the answer to. Another important part of keeping up to date is making sure that clinical resources are readily available to staff. Now, we already talked about immunization schedule, but there are other resources that are helpful, like clinical guidelines, job aids, and videos that staff should have access to. Now, these resources can teach you about vaccine storage and handling, vaccine administration, and other topics. And you can find these resources on the CDC website at the address listed in the blue box. You should also tell your staff where to access this information in your practice, such as if you have a special binder or certain pages bookmarked in your web browser for the resources most commonly referenced by your staff. Now let's talk about how to create a culture of immunization in your interaction with parents. The first step is to assess a child's vaccination status at every visit. Now, this is most relevant for the clinicians who are deciding which vaccines to administer, but all staff should know that this is a priority. A clinician should check the Immunization Information System, or IIS, if in your state, if applicable, for child's vaccines, and to determine which vaccines the child has already received. Now, this should be done at every visit, every well visit, during a sick visit if they're well enough to receive vaccines, or a follow-up visit. If they're coming back to follow up for a chronic condition, they should be assessed each time they come in. And that's just to minimize the missed opportunities to vaccinate. You want to screen for contraindications and precautions each time vaccines are given. And this is because you want to make sure that a new contraindication or precaution hasn't arisen since the last time they were vaccinated, or if they had a contraindication or precaution, sometimes contraindications or precautions can be due to a temporary condition, and if that's the case and that condition has resolved, then you want to make sure that you are assessing whether or not they are eligible to receive vaccines. And then you want to give all eligible vaccines in the same visit. There are no known benefits to spacing out vaccines. Just leaves children vulnerable to diseases during the time that they are not protected by vaccines when they're spacing them out. So again, this strategy will reduce the missed opportunities to vaccinate and reinforce the message that vaccinations are important. Now, way number 5 is to give strong and compelling recommendations for immunization. Now, research has shown that an effective recommendation from a healthcare professional is the main reason parents decide to vaccinate. So whenever your clinicians give strong recommendations for vaccinations, other staff should reinforce them. Now, when talking about the vaccines that a child will get that day, it can help to take what we call a presumptive approach, which means that you simply announce which vaccines the child will be getting. This has been shown to be more effective than asking parents what they want to do about vaccines. So the third bullet, this shows an example of how this can be done. So this is an example of bundling all vaccines into one recommendation and using a presumptive approach. So you would say, Michael is going to get 5 vaccines today: DTaP, rotavirus, Hib, pneumococcal, and polio. And then this method, that's the presumptive approach, as opposed to saying, hey, have you thought about whether or not you want to get vaccines for Michael? That's the asking. So make sure you give that strong, presumptive, bundled recommendation when speaking to parents about vaccination. And then explaining the importance of each vaccine in every dose can help ensure the parents follow the recommendations. Now, anyone in the practice can share personal experience with a vaccine-preventable disease or talk about why they decided to vaccinate their own children. These stories help to reinforce the vaccine recommendations and the importance of vaccines for the parents and the importance of vaccines to you as a professional. Now, number 6 is to help parents feel supported by welcoming questions and knowing how to answer them. Emotions can play a strong role in how we make decisions. How we make parents feel is equally as important as what we say to them. Now, you want parents to feel supported when they bring their child to your practice, and you can do this by welcoming their questions and knowing how to answer them. It's important to recognize that just because a parent has questions about vaccines doesn't mean that parent has concerns or is opposed to vaccines. Most parents have questions even if they plan to vaccinate. So if everyone in your practice learns how to answer common vaccine questions, you can help save time in the exam room and increase a parent's confidence in your practice. So I'll go through some common questions and answers in the coming slides. Now, if you don't know how to answer a question, that's okay. You can always refer the question to another vaccine expert, to another doctor or a nurse, and you could also always write into that email address on a previous slide, the nipinfo@cdc.gov, to get some insight onto how to answer a question as well. And in the questions that I'm going to go through in the coming slides, we actually have a website on a web page on the CDC website that goes through a lot of common questions that parents have and how to answer them. So we'll go through that here next. So here are some common questions about infant immunizations. Are vaccines safe? What are the side effects of vaccines? How do I treat them? What are the risks and benefits of vaccines? Is there a link between vaccines and autism? Can vaccines overload my baby's immune system? Why are so many doses needed for each vaccine? Why do vaccines start so early? What do you think of delaying vaccines? Et cetera, et cetera. And I'm sure some of you may have heard these questions from parents more than once. But to get answers, there in that blue box at the bottom of the slide is the web page where we have parent questions and answers. And so I'll go through a couple of those here in the coming slides. So a common question you may receive is, are vaccines safe? And one way you can answer it is by saying, yes, vaccines are very safe. The United States' longstanding vaccine safety system ensures that vaccines are as safe as possible. Currently, the United States has the safest vaccine supply in its history, and millions of children safely receive vaccines each year. The most common side effects are typically mild, such as pain or swelling at the injection site. You can also learn more for yourself about the CDC's vaccine safety systems, including systems you may have heard of, such as the Vaccine Adverse Event Reporting System, or VAERS, the Clinical Immunization CISA review group. You can learn about them. Also the FDA monitoring. So there are additional information that you can educate yourself on as well to help better be able to explain the systems that are in place to monitor vaccine safety when those questions come up. Next question, what are the side effects of vaccines? One possible answer is that vaccines, like any medications, may cause some side effects. Now, most of these side effects are very minor, like soreness where the shot was given, fussiness, or low-grade fever. These side effects typically only last a couple of days and are treatable. For example, you can apply a cool, wet washcloth on a sore area to ease discomfort. Serious reactions are very rare. However, if your child experiences any reactions that concern you, you should call the doctor's office. So that gives an answer to the question and provides you as a resource to that patient should they have any additional concerns that arise. Is there a link between vaccines and autism? So no, scientific studies and reviews continue to show no relationship between vaccines and autism. Now, at one time, people suggested that thimerosal, which is a preservative compound that contains mercury in the vaccines given to infants and young children, might be a cause of autism. And others have suggested that the MMR, or measles, mumps, and rubella vaccine, may be linked to autism. However, numerous scientists and researchers have studied and continue to study the MMR vaccine and thimerosal and reached the same conclusion, that there is no link between MMR vaccine, thimerosal, and autism. Now, another interesting note that sometimes parents aren't aware is that most childhood vaccines do not contain thimerosal. In fact, no routine childhood vaccine contains thimerosal, with the exception of some multi-dose vials of the flu vaccine. So even for flu vaccine, there are options that don't contain thimerosal. So this is all information that you can use and also available in the CDC's vaccine safety website that you can use to answer these questions. Another common question that you may have heard is, can vaccines overload my baby's immune system? Now, here's a possible answer for vaccines do not overload the immune system. Every day, a healthy baby's immune system successfully fights off thousands of germs. And antigens are part of germs that cause the body's immune system to go to work to build antibodies, which fight off diseases. Now, antigens in vaccines come from the germs themselves, but the germs are weakened or killed so they cannot cause serious illnesses. Even if a baby receives several vaccinations in one day, vaccines contain only a tiny fraction of the antigens they encounter every day in their environment. And of course, we all see babies and kids who crawl all over the ground and then put their fingers in their mouth. So the vaccines are just a fraction of what they encounter every day in their environment. And vaccines give children antibodies they need to fight off serious vaccine-preventable diseases. Another interesting fact that I like to add when I answer this question is that the amount of antigens in vaccines have actually decreased over time. So while there are more vaccines, the amount of antigens that our children and infants and children receive are actually less now than when, say, I was a child and received vaccines. And that's partially for a couple of reasons. One, the smallpox vaccine, when that was administered, had more antigens than the vaccines have now. And additionally, back when we used the wholesale pertussis vaccine, the wholesale pertussis vaccine had far more antigen in that vaccine alone than the combined total of antigen from all the vaccines that children receive now. So that's a fact that I like to use when I'm answering that question. Now, here's another question you may often encounter is why can't I delay some vaccines if I'm planning for my baby to get them all eventually? And we get this question a lot. Of course, young children have the highest risk of having a serious case of disease that could cause hospitalization or death. And delaying or spreading out the vaccine leaves the child unprotected during the time when they need vaccine protection the most. And then you can give examples, like, for example, diseases such as Hib or pneumococcus almost always occur in the first 2 years of a baby's life. And some diseases, like hepatitis B and whooping cough, are more serious when a baby gets them at a younger age. So vaccinating a child according to the CDC's recommended immunization schedule means you can help protect them at a young age. And when answering this question, I also note that it takes multiple doses of the vaccines for them to reach the full level of protection. So when a parent chooses to spread out the vaccines, they're basically increasing the time before they get the number of doses needed to reach that level of protection. So that's another thing that I say when I'm answering that question. The next question is, what are the ingredients in vaccines and what do they do? Vaccines contain ingredients that cause the body to develop immunity. Vaccines also contain very small amounts of other ingredients, and all the ingredients play necessary roles in either making the vaccine or ensuring the final product is safe and effective. And you can learn more about specific vaccine ingredients through the Pink Book or the FDA website as well. Another question from the list was, why are there so many doses needed for each vaccine? Now, getting every recommended dose of each vaccine provides the child with the best possible protection. Now, depending upon the vaccine, a child will need more than one dose to build high enough immunity to prevent disease or to boost immunity that fades over time. So you can also explain that your child may also receive more than one dose to make sure they are protected if they did not get immunity from the first dose, or to protect them against germs that change over the time, like flu, which is why we get the flu shot every year. And it's important to stress to the parent that every dose is important because each protects against infectious diseases that can be especially serious for infants and very young children. Now, CDC also has a suite of materials to help healthcare professionals communicate more effectively with parents about vaccines. It's called Provider Resources for Vaccine Conversations with Parents. CDC developed these together with the American Academy of Pediatrics and the American Academy of Family Physicians. The materials include guidelines for talking to parents about vaccines. Now, this is a 4-page fact sheet, and it provides tips for how to have successful conversations and examples of how to answer tough questions, similar to some of the answers that we just went over in the previous slides. There are also fact sheets on different vaccine safety topics, like how vaccines work, MMR vaccine safety, the Vaccine Adverse Events Reporting System, or VAERS, and how the government ensures vaccine safety. Now, this is great knowledge for us as providers, and we can also share these with high information-seeking parents who have specific vaccine safety questions that are covered by these topics. There are also vaccine-preventable disease fact sheets for parents. Now, these are written in plain language and are available in both English and Spanish. And they're a great resource for parents who have questions about specific diseases. We can also distribute these if there's a disease outbreak in the community. And I think it's important to note that sometimes parents don't know the risks associated with the different vaccine preventable diseases because we don't see them as commonly in society anymore, and that's due in large part to the success of vaccination. So because they haven't seen the vaccine preventable diseases, they can be unaware of some of the potential complications from the vaccine preventable diseases when they are making vaccine decisions. So you really want to make sure that they have all of the information that they need when making these decisions. And finally, there's a fact sheet for parents who choose not to vaccinate. Now, this fact sheet explains responsibilities of parents who choose not to vaccinate and specific steps that they need to take in case of an outbreak or if their child gets sick. Now, while we work hard to ensure that all children in our practice are vaccinated, this may be useful for sharing with parents who are considering not vaccinating. There are also other resources on this website, like a video showing a doctor speaking with a mom's group about vaccine questions, and fact sheets on other topics like combination vaccines or topics such as vaccinating when a child is sick and when you can vaccinate when they're sick. Number 7 for creating a culture of immunization in your practice is to give the vaccine information statements, or VIS, and other handouts to your parents. And that's another way to show that we value immunization. Now, federal law requires that a VIS be given at every vaccine visit. So if you are involved in administering vaccines, make sure that the VIS are given before any vaccines are given. Parents are unlikely to read a VIS if you give it to them as they are walking out the door. So if you give it to them while they're waiting to have the vaccines administered, or in some cases if you give it to them the visit before the vaccines are due, if possible, that gives them more time to read it as well. There are also many other handouts from CDC, the Children's Hospital of Philadelphia, and the Immunization Action Coalition that can answer specific questions about vaccine safety, vaccine ingredients, and other topics. So it's worth taking time to review these other resources and keep copies on hand for parents who have questions. The 8th way to make a culture of immunization is to make immunization resources easy for parents to find. As I mentioned earlier, many parents have questions about vaccines, and even if they intend to vaccinate their children. You can help parents get their questions answered by making immunizations resources easy for them to find. Now, you can do this by including the immunization schedule and other handouts in new patient packets, creating a waiting room display with handouts or other information about vaccines, posting parent-friendly versions of the immunization schedule in exam rooms, and again, you can include those into the patient packet as well. You can also syndicate CDC web content on your website or on the practice website, or post CDC web buttons on the website. Posting a web button on your website that links to the CDC's website for parents is also another button that you can post, and it can take them straight to the parent website and the making the decision to vaccinate website. You can share resources with parents via social media, and you can insert auto text dot phrases into the electronic medical records for easy printing. And I'll give you some examples of this coming up. So here are some sample EMR auto text dot phrases, information about vaccines. So I know that all EMRs are different, so check with the person who manages the EMR in your practice to see if this would be possible. But you could have information that automatically populates into the printout that the patient gets at the end of the visit that provides this information. So we're so excited that you want to learn more about protecting your child through on-time immunizations, and our healthcare professionals trust these websites. And then list the websites that you trust for them to receive vaccine information. And having websites that trusted websites readily available for parents is important. I think if you haven't, if you ever Googled, are vaccines safe or should I vaccinate? A lot of times there are websites that pop up that look like they are scientific websites or they look very official, but they may not be based on science, that website. So you really want to make sure that parents know which websites you trust and you are guiding them on where to go to get their information. The ninth way is to schedule follow-up immunizations before the child leaves the office. Now, once the immunizations are given, there are still a few more things you can do before the parent walks out the door. You can encourage parents to schedule their child's next immunization appointment before leaving the office. So the clinician should ensure that this appointment falls within the recommended time frame of the CDC schedule. Now, if a parent defers scheduling for any reason, they're running late or they don't have their calendar with them, etc., then you want to offer to call them a few days later. That can be another opportunity to potentially schedule that appointment, even if they were unable to schedule that appointment prior to leaving the office. Now, also during checkout, you can tell the older children that they did a great job and offer them a sticker or other small prize if they got vaccines or immunizations at that visit, or anything else at that visit for that matter. Now, the 10th way to create a culture of immunization is to remind parents about upcoming immunization appointments and contact those who miss appointments. Now, you can continue to remind parents about the importance of immunizations even when they are not in the office for well visits. So you can do this by reminding them about upcoming appointments, either by phone, by text message, email, or postcard. I think we all get those text messages and emails for our own appointments as well. And you remind them about immunizations when children are in for sick visits. So remember, when they're in for the sick visit, that first thing is assessing their status, that first parent-related item is assessing their status. And so you also want to, when their parent comes in, you want to let them know we assessed your child's immunization status and they're all up to date or they're due for these vaccines, etc. And then you want to call parents to follow up if their child misses an appointment. Now, it can be helpful to tell parents why you're being so diligent about reminders and follow-ups. And it's because their children are not fully protected until they receive all recommended doses of a vaccine. Now, so that's the list of the 10 ways to create a culture of immunization. Now, there are some other resources for healthcare professionals that I also wanted to highlight. We talked about this before, but the CDC Immunization Training webpage is here, noted on this slide. And that's the first slide. And again, you can sign up for email alerts to be alerted for when there are new webinars or new products available for you to review. There's also a CDC MedState continuing medical education on pediatric immunization, navigating difficult conversations with parents. We also have CDC Medscape expert commentaries as well that discuss conversations with parents, and there's also one on HPV vaccine specifically for conversations with parents of adolescents as well. The AAP has immunization resources on their page listed there. The Immunization Action Coalition, immunize.org, the immunize.org page has a lot of information for providers, a lot of printable sheets that you can put up in med rooms or in other places in the office, things that can be put in binders about vaccines and vaccine recommendations. They also have a section on having conversations about vaccines that deal with certain topics. So for instance, they have a section on religious concerns in vaccination, et cetera. And then the Medical Assistance Resources and Training on Immunization, or MARTI website, also has resources as well. And finally, at the bottom of the list is the Children's Hospital of Philadelphia Vaccine Education Center website. Now, this is a website that I refer to on a regular basis that deals a lot with vaccine safety and common questions. They talk specifically about common vaccine ingredients and ingredients that parents often have questions about. So those are available as well. If you have questions, I believe you put them in the chat box. And we'll see if anyone has any questions. Thank you all very much.
Thank you, Candace, so much for presenting today. We'd like to offer a little more time for last-minute questions. I know we didn't really get a whole lot that came through, so go ahead and take the time to include those in the chat box. And while we are waiting for some of those questions to come in, I will just remind you of a couple of things. If you have requested nursing or pharmacy continuing education credits for today's webinar, please make sure that you complete the survey, which will pop up on your screen at the completion of the webinar. And then I will also make sure that we send out a post-webinar email just reminding you of taking that survey. If you've taken it right after the webinar, then the link will not end up being included in that email, so just disregard if you've already taken the survey. And then, of course, give us about a week to get those CEUs sent out. And if you have questions in the meantime, feel free to email us. If you'd like to view or share this webinar, the recording will be available on the Immunize Nevada website along with information for future webinars. So just please visit immunizenevada.org/webinars for those details. Okay, so we did get one question, and I will go ahead and repeat that back. And Candace, then you can go ahead and answer it. Oh, just kidding. This one is for me. Somebody asked if they will receive the slides so that they can access the provided links that were in the presentation. And yes, it will be posted to the Immunize Nevada website. So you just go ahead and refer there, and then you can download the entire presentation from that website. That
and I will also note,
webinar. Yes.
Oh,
yes.
Sorry. I was going to also note that if you went to just www.cdc.gov/vaccines, you can pretty much access all of these through that base web address. So if you go to that site, there are a section with resources for parents, one for healthcare providers, one for adults, etc. And you can pretty much access all of this information through that base link as well. So that's another option as well. But you will get the slides with the direct links to the resources provided.
Perfect. Thank you, Dr. Robinson. Okay, well that concludes today's NILE webinar. Thank you again so much, Dr. Robinson, for spending the time to present and providing all the information that you did. I hope everybody has a great day and a great rest of your week.
Thank you.
Thank you.
Bye.